Hello, my name is Lauren, and I'm going to be discussing my project for the Walden assignment. The premise of my project would be lessening the burden of heart disease risk factors among Native Americans in Yuma, Arizona. And I chose this particular topic because Native Americans are at a greater risk for heart disease, and that's because largely their population is predisposed more heavily to smoking, low physical activity, diabetes, and poor health choices, unfortunately, as a result of poor health literacy. And ultimately, the funder has decided, which the funder would be the Department of Health and Human Services through the Center of Disease Control, had set forth this program or this funding opportunity because they were looking to implement a holistic and culturally adaptive approach to reducing tobacco use, improve physical activity and nutrition, and increase health literacy among Native Americans. And so thankfully their objectives aligned very closely with ours, and so we were able to collaborate very well in that sense. One particular barrier, however, would be that they want to implement this on a nationwide scale, which I think is a unique and interesting challenge. But when we have gone through the program design on our particular program, we were utilizing input by Native Americans in Yuma specifically. So I don't know that the input provided by them would necessarily be applicable to, for instance, a tribe perhaps living in the Midwest. So it may not be 100%. You wouldn't be able to exactly copy and paste it into another region. Ultimately, you'd have to address the specific needs of the other community members. Ultimately, to overcome to work the barrier would include speaking with whatever tribe that decides to take on our particular project and our best practices, and then speak with the other program designers, assuming that it's not us, and ultimately see which challenges were unique to our Yuma tribe, and then which challenges perhaps are different for the other tribes, and then make those specific adjustments accordingly. Ultimately, building relationship will be based in communication. So, of course, we'll be providing more formal aspects of communication, which would include published reports of our monitoring and evaluation. However, even just checking in throughout the month, throughout the week, if necessary, to show our progress, how things have been doing, and then, again, ultimately just keeping that communication open. Their influence The funder's influence is very important, of course, because they're providing the funding for it, and we are accountable for what we promise to do, and it is our responsibility, and that would be a part of a letter of agreement, a memorandum of understanding to ensure that they are providing the funds to us as they promised they would, and in turn we're keeping our end of the bargain by providing the care, providing the measurable outcomes that we promise to do so. So ultimately, through communication and accountability, we would be able to work together with the funders, in addition to working together with the Native Americans to ensure that the Native Americans are getting what they need, but ultimately that the funder and our program designers are working well together. Thank you.